Dr. Nina Kramer.
And I'm Dr. Dennis Davis.
So Dr. Davis, what are some treatment options that a periodontist offers?
A periodontist is going to do a thorough examination, and then they're going to assess the quality of the disease process or the extent of the disease process and make his or her recommendation based on that. And oftentimes, a patient only needs scaling and root planing and more tightened or more frequent maintenance intervals. But if they have more advanced disease, then some of the more advanced minimally invasive procedures are laser-assisted periodontal therapy. This therapy is much easier for patients to tolerate, and there's very little downtime, and it's very effective. If the disease process is even more advanced, we have techniques at rebuilding back the lost gums and bone that has occurred from periodontal disease. We oftentimes use stem cells, growth factors that even come from your own blood through special processes to take what we need, take these good cells and incorporate them into our therapy to get a better result and with less discomfort.
Thank you for watching our short video today. If you have any further questions, please contact our office at 352-259-6799.
Thanks again, appreciate it.